Okay, so the first thing I'm gonna do is I'm gonna gather my supplies and I'm gonna walk into the patient's room. I'm gonna wash my hands. I'm going to check their name and date of birth. Can you tell me your name and date of birth? Okay, and I'm gonna check the armband and make sure that's correct, and it is. I'm also gonna check my MAR and make sure that I got the correct order on there for the procedure that I'm doing. I'm gonna ask the patient if they have any pain, and they said they do not have pain. I am going to make sure they have no allergies. And do you have any allergies? No? And that matches up with the computer. So I'm just gonna look on the outside of the dressing here and everything looks okay. So I'm going to change your dressing and we're going to irrigate it and I'm gonna take a wound culture. Is that okay with you? All right, they said yes, that was fine. So I'm gonna put my gloves on. And as I'm taking this off, I'm going to hold the skin down to make sure that it's not pulling against it. And I'm just gonna take the corners off slowly. Once I get it off, I'm going to assess the drainage, the color, consistency, odor, and the amount, and that will be documented. And I'm gonna just throw this in the trash then. So my trash can is down here. Now I'm going to take the dressings out and I'm going to be sure that my fingers don't go into the wound. So I'm just going to carefully take it out, and then my dressings will also go in the trash as well. My tweezers will go in the sharps container. So I'm going to pretend put them in there, but they're going for my next procedure. I'm going to measure the wound lengthwise and widthwise with this, and I'm going to be sure that it does not touch the wound at all. And then that will be documented. And then I'm going to use my sterile Q-tips, which have been used before, so that's why the package is already open. But I'm going to do the 2 Q-tip method, and it was said that if you put it, it's better to put it in like normal saline solution so that the fibers don't get stuck in the wound. So I'm going to dip this in saline solution to use it. So I'm going to measure the depth, and I'm going to go around the wound, and I'm also going to find the deepest part, which the deepest part would be 6 o'clock. And I'm going to take that part and I'm going to measure it, and then that will be documented. And then this is also my tape measure. And then I'm going to do the undermining and the tunneling, and I'm going to go around the wound and do the undermining. Be careful not to touch the skin or the wound. And I'm going to measure the undermining with my ruler, and then I'm also going to do the tunneling, and I would document those according to like the time, you know, the placement. So the tunneling is at 12 o'clock on the wound, and the undermining is at 8 o'clock on the wound, and those both get measured and documented. And then these go in the trash down here. So the next thing that I'm going to do is I'm going to irrigate the wound. So I'm going to put my pad underneath, and then my pan right here. All right, sir, I'm just going to tip you over here. We're going to roll over. Now I'm going to do normal saline solution, and I'm going to do it from clean to dirty and let it just drain down. And then this will also be disposed of. So once that drains, I'm going to assess the wound and make sure, I'm going to document what the wound looks like. So from 12 to 5, there is slough in the wound, and then from 5 to 12, it is the granulation tissue. So after I do my assessment, I'm going to do a quick culture. And for that, I have this, again, this was already open just from practicing, so I'm still going to obviously practice as if it were sterile. So I'm going to take this off, and the Q-tip is the sterile part. So the lid comes off, and this can get disposed of. So when I take this, I'm going to do a zigzag motion downwards, and I'm also going to be spinning it at the same time to make sure that I get a good, you know, all of the wound together. And then this is gonna go in, and I'm gonna be sure not to touch the cotton tip to, you know, anywhere on the outside of the container. And then I will fill the label out, and this will get sent to the lab. When I'm done, I'm going to prepare for my sterile procedure, which means I'm gonna have to take my gloves off. They will go in the trash, which is down here, and I'm going to wash my hands. And if I have to leave my patient, I'm going to lower his bed back if I have to leave his bedside.